Well, hello, it's Bruce Williams again, and it's Friday, so it's time for another Gross Path Challenge. This one is going to be in multiple choice format, and that reminds me that I want to wish all those candidates who will be in Tampa in a couple of weeks taking the ACVP exam good luck. Next 2 Fridays, I'm going to be lecturing in Philadelphia and on vacation myself, so it'll be a couple of weeks and all of you will be done with that experience by the time I give you Gross Path Challenge number 49. So best of luck in Tampa. I hope these little quizzes have been of some help. With that, I'll always thank my friends and colleagues who have provided me great images over the years. Let's get out our pencils, our pens, and our papers, and let's start. Slide number 1 is tissue from a rabbit. The question is, which of the following organs also contains a primary necrotizing lesion? Your choices are A, kidney, B, spleen, C, lung, or D, intestine. Which of the following organs also contains a primary necrotizing lesion? Be back in just a moment with the answer. Okay, your time's up. This question straight out of Percy and Barthold on page 96. We're looking at a primary necrotizing lesion in the liver. We have coalescing areas of hemorrhage. The light areas are probably remaining hepatocytes. The dark areas are areas of hemorrhage where hepatocytes have become necrotic and are lost. You can tell the liver's lost a lot of mass because it conforms to the shape of the surrounding tissue, sort of draping over them like an old washcloth. So, if you have a primary necrotizing lesion in the liver of a rabbit, you certainly want to think about rabbit hemorrhagic disease or calicivirus. This isn't patchy abscesses, which you might see with gram-negative sepsis. This is a diffuse necrosis of the liver. Your choices were A, kidney, B, spleen, C, lung, or D, intestine. The correct answer here is D, intestine. There is necrosis within the intestine of affected animals. This virus is also endotheliotropic, so you may see hemorrhage in multiple organs, but it's not a primary necrotizing lesion. You can see that in A, B, and C. And C, lung, is one that shows up very nicely because you have these large areas of hemorrhage resulting from DIC, thrombosis of pulmonary capillaries. These animals primarily die of DIC. They don't live long enough really to die of liver failure, and if they live that long, the DIC would even be worsened because the liver is where your coagulation factors are made. Whack the liver, eventually you'll die of DIC. Okay, slide number 2. Slide number 2 is also from Percy and Barthold, and this is tissue from a rat. The neoplastic cells in this condition arise in which organ? Your choices are A, liver, B, spleen, C, thymus, or D, lymph nodes. Once again, the neoplastic cells in this condition arise in which organ? A, liver, B, spleen, C, thymus, or D, lymph nodes. Okay, time's up. This is a rat. Remember, whenever you see a big liver over here and a big spleen in any rodent species, you'll want to think about lymphoma first and foremost. This is a variant of lymphoma which is very common in certain strains of rats, including Fisher 344 rats, and which aren't used all that much because they get so many tumors, but it's a shame because they're nice rats. You have a big liver, a big spleen, and when you think about rats, you want to think about mononuclear cell leukemia. This used to be called large granular cell leukemia, which is a morphologic change. It's a mononuclear cell leukemia because the origin of the cell really is still in doubt. But the neoplastic cells in this condition are thought to arise in B, the spleen. This is an important condition that you need to know about in rats. These Fisher 344s get other neoplasms, including interstitial cells of the testis, and mesothelioma, which often affects the tunics of the testis, You may see it in the abdomen. I have seen cases in which all three were present in the same testis. I think there's one back in the Wednesday slide conference. What a horrible slide to put on a certifying examination. I'm not going to say it hasn't been done before either. Okay, slide number 3 is tissue from an ox. In a recent retrospective of natural infections, which of the following was observed? A. Multiple infarcts in infected animals. B. Fasciola hepatica infection. C. Activated caspase 3 in hepatocytes outside of the area of infarction. Or D. Epsilon toxin throughout the liver. Once again, this is an ox. In a recent retrospective of natural infections, which of the following was observed? A. Multiple infarcts. B. Fasciola hepatica infection. C. Activated caspase 3 in hepatocytes outside of the area of infarction. Or D. Epsilon toxin throughout the liver. Okay, time's up. Well, this question comes out of a 2017 article by Navarro et al. On pathology of naturally occurring bacillary hemoglobinuria in cattle. Because bacillary hemoglobinuria is caused by a Clostridium hemolyticum. You know, my good friend Paco Uzal, president of the foundation, has his name on this because he believes that everything is caused by Clostridium. And the more papers that he publishes, the more I'm starting to agree with him. Okay, in this particular question, the correct answer is C. Activated caspase 3 in hepatocytes outside of the area of infarction was observed. This was a finding in this paper which suggested that the hepatocytes outside the necrotic focus were undergoing apoptosis. Okay. Other things that were seen in this paper. The foil number A, which said multiple infarcts. This paper agrees with a lot of literature that sort of differentiates bacillary hemoglobinuria by the presence of a large infarct in cases of Clostridium hemolyticum with black disease caused by Clostridium novii, which has multiple infarcts. Okay, B, Fasciola hepatica infection. That's been associated with Clostridium novii. Migration of immature Fasciola hepatica on the way to the bile ducts. A lot of people say fascioloides magna because you have black streaks in that. Fascioloides magna, forget about that in terms of either of these conditions. That will cause large areas of necrosis. It will kill small ruminants on their own, but it's usually not associated with Clostridium. Can be in rare cases. But Fasciola hepatica infection, the migration of immature flukes is enough to set off Clostridium novii. This particular paper said that there were no gross or microscopic lesions indicative of fasciolitis. And the bile ducts look really nice in this particular case. And finally, foil number D, epsilon toxin throughout the liver. No, the toxin associated, at least in this paper, with Clostridium hemolyticum was beta toxin. Question number 4. This is tissue from a merganser, which is a duck. Name the most likely cause. A, Candida albicans. B, vitamin A deficiency. C, Capillaria aerophylla, also known as Eucolium aerophylla. Or D, Trichomonas gallinarum. Once again, Candida albicans, vitamin A deficiency, Capillaria, or Trichomonas gallinarum. Okay, time's up. This one is from the Avian Disease Manual, pages 143 through 144. The correct answer is A, Candida albicans. You have this sort of whitish plaque. It can be very difficult to differentiate some of these. So I picked some that I thought you might be able to differentiate from. Vitamin A deficiency. Vitamin A deficiency is usually more pinpoint. You tend to get keratinization of the normal glands of the crop, and you will see their ostia openings because you'll have the white material poking out. But it's much more pinpoint, much more discrete than you would see with Candida. Capillary eucolia or eucoleus, it is a sort of very thin membrane off the top. If you look closely, you can see the presence of the fine worms, but not this big whitish plaque. And finally, Trichomonas gallinarum. I don't know. I suppose that you could get that in ducks. It is usually a disease of pigeons and animals that eat pigeons. It's called canker in pigeons. It's called frounce in raptors. In pigeons, you can get this sort of necrotizing lesion, but they tend to be more focal. They tend to be more clumps of necrotic tissue and not as commonly seen in the crop. In raptors, they tend to be areas of necrotizing stomatitis, which can go deep and become osteomyelitis more in the mouth than they are further down. The crop is often a great spot to find Candida. Crop mycosis is a classic disease of these animals and these plaques. I did not put wet pox. I would have trouble differentiating this from something like wet pox. In most cases, it's nice to have a differential diagnosis, but sometimes you're going to get pinned down and you want to be able to have a reason to back up your choices. And I think for inglovitis, Candida, especially with a plaque-like lesion, is always a pretty good choice. Okay, let's move on to slide number 5. This is tissue from a dog. Name the condition. Your choices are A, pancreatic atrophy, B, pancreatic hypoplasia, C, Meckel's diverticulum, or D, yolk sac remnant. Once again, name the condition. Pancreatic atrophy, pancreatic hypoplasia, Meckel's diverticulum, or yolk sac remnant. Okay, time's up. This one's straight out of Job and Kennedy, Volume 2, page 363, and the correct answer is pancreatic atrophy. This is a condition in dogs that starts very, very early on. It's an interesting condition. It is an autoimmune condition. CD4 and 8 positive cells are directed against pancreatic acini, and they basically take them out without any fibrosis. It's a unique way that it happens in the pancreas. Similarly, autoimmune lesions usually have a lot of fibrosis, especially in the thyroid when I think of those animals. But this just sort of disappears. You can see fibrous connective tissue and vessels, and you can see what's left of the islets, but everything else is just gone. This animal would have foul-smelling, voluminous stools with lots of undigested protein and fat. Would not make a very good house pet. And it's seen in higher prevalence in collies and German Shepherd dogs. Back in the day, a lot of these were called hypoplasia because the lesion is so advanced early on in the animal's life. But it has been determined over the years that this is truly atrophy. So the pancreatic hyperplasia, foil number B, has pretty much been dropped from the picture. This is true atrophy. Okay, well, it's not true atrophy. I shouldn't say that. Sometimes I hear myself saying things and I need to correct them. It is called pancreatic atrophy. Atrophy is normally a lack of stimulation, and stuff goes away because they're not stimulated. These animals are eating, so it's not atrophy. It's really an immune-mediated disease, but people call juvenile pancreatic atrophy, and that's just the name of it. And we all have to think more before we name things, I suppose. C, Meckel's diverticulum. No, that would be a diverticulum, a pouch off of the intestine itself, which is often in the area of the yolk sac. D was yolk sac remnant, sort of the same thing, except the yolk sac remnants often will have some membranes and some yolk sac material left. and then they become fibrotic as the animal gets older. A very classic appearance for pancreatic atrophy. Here's a great picture. I think it was originally many years ago published by the American Association of Avian Practitioners. I've been using it for many years. It's a goodie. And we're going back to the Avian Disease Manual for this one. This is tissue from a chicken. Name the most likely cause. Your choices are A, Mycoplasma gallisepticum, B, Pasteurella multacida, C, Mycobacterium avium, or D, Gallid herpes virus 2. Once again, Mycoplasma gallisepticum, Pasteurella multacida, Mycobacterium avium, or Gallid herpes virus 2. Take a think. I'll be back in a flash after a sip of coffee. Okay, Avian Disease Manual, pages 97 through 100. This is a classic presentation of chronic pasteurellosis. So the correct answer is B, Pasteurella multacida. Pasteurella multacida, it comes in two forms, the acute and the chronic form. The chronic form are the ones that sort of maintain it in the flock. The acute form are the animals that die pretty quickly as a result of septicemia. Pasteurella is a pretty angry bacterium in many species, and in chickens and turkeys it can be very angry and result in sepsis. These animals have hemorrhages all over the place. It's one of the big triad that I think of when I see animals with hemorrhages all over visceral organs. Pasteurella is the most common, and then you have to think about the other two, which are uncommon and ones that will give you a real problem. Those are highly pathogenic avian influenza or visceral velogenic Newcastle disease. Obviously, both reportable diseases. Pasteurella is not, but you got to think about it when you see a lot of hemorrhage. Now, this particular bird did not die of pasteurellosis, but it has become a carrier. And one of the things that you'll see, in addition to arthritis and sinusitis, is you'll see these large caseating abscesses. Well, birds don't have abscesses. They're caseating granulomas or heterophilic granulomas within the comb and the wattles. And so these, if you cut them in half, you're going to see a caseous core within them. Very classic for chronic pasteurella. They also will get a variety of conditions. You'll see arthritis, you'll see salpingitis in laying hens. These are ones that maintain the bacteria in the flock, and then you'll have periodic outbreaks. So, great picture of Pasteurella multacida causing these big granulomas within the wattles. Okay, your other choices, Mycoplasma gallisepticum. I certainly would probably have given you something that had a large granuloma within the infraorbital sinus. It's a classic lesion associated with Mycoplasma gallisepticum in a variety of avian species. In finches, that particular animal causes conjunctivitis, and in poultry you can see arthritis associated with that. A lot of times in certain parts of the country, and here in Maryland, you'll get the sinus lesion associated with Mycoplasma synovii. They seem to, at least around here, you never know what you're going to get. You can get galliseptum out of the joints, you can get synovii out of the sinuses, just to trick you up a little bit. Mycobacterium avium, that's going to cause granulomas all over the place in birds. You don't see Mycobacterium avium a lot in poultry because most of them don't live long enough to get the classic granulomas. You'll see that in all of the viscera. You don't see it a lot in the skin, and it doesn't really cause this lesion. And then finally, Gallid herpes virus type 2, the causative agent, and alpha herpes virus, which causes Marek's disease. You may get follicular tumors, which will cause swelling of all the follicles along the legs, but not these big tumors or not these big swellings of the wattles. Classic Pasteurella multacida. Okay, slide number 7 is tissue from a rabbit. We're going back to Percy and Barthold. And which of the following is true? A, intracytoplasmic inclusions are present in proliferating fibroblasts, but not the overlying epithelium. B, Lesions may be seen in viscera and bone marrow of young rabbits. C. Direct contact between individuals is required for transmission. And D. Infection results in high mortality in infected cottontail rabbits as a result of visceral metastasis. Okay, once again, which of the following is true? Intracytoplasmic inclusions are present in proliferating fibroblasts, but not the overlying epithelium. Lesions may be seen in viscera and bone marrow of young rabbits. Direct contact between individuals is required for transmission. Or D. Infection results in high mortality of infected cottontail rabbits as a result of visceral metastasis. Think about that one. I'm being tricky here, and I'll be back in just a sec. Okay, time's up. We're looking at the foot of a cottontail rabbit, and we have a large neoplasm on the foot. This one's been incised, it's been cut in half, but this is a Shope fibroma, classically caused by a pox virus identified by Dr. Shope during his work at NIH many years ago in the 30s and 40s. He got a lot of things named after him. The Shope fibroma virus, the Shope papilloma virus, but he didn't work much with rabbits, interestingly. Okay, let's get back to this particular tumor. Shope fibromas. Hopefully you've been caught up on VISPO. Shope fibroma is caused by the exact same virus that causes myxomatosis. In Shope fibromas, you see intracytoplasmic inclusions within the fibroblasts that make up the tumor and the overlying epithelium, but in myxomatosis, they are relegated only to proliferating fibroblasts and don't affect the overlying epithelium. Got to get that one straight in your head. So Shope fibromas, you'll see them in the epithelium overlying it as well. B is correct. Lesions may be seen in the viscera and bone marrow of young rabbits, not in adult rabbits. They don't metastasize in adult rabbits, but you can see similar lesions in the viscera in young rabbits. Shope fibromas tend to regress as well. So I think maybe that young rabbits, their immune system is just not mature enough to prevent this from spreading, but it is in older animals. C is incorrect. Direct contact between individuals is not required for transmission. It may be transmitted by biting insects, maybe why a lot of animals are previously sort of inoculated against it. But so direct contact between individuals is not required. You can have fomites, you could transmit it by injections or something like that. So C is not correct. D, infection results in high mortality of infected cottontail rabbits. We can stop right there. Shope fibromas don't kill rabbits. As a matter of fact, sometimes, or in the past, they used to be ground up and injected as a potential vaccine for myxomatosis to try and prevent it, because animals don't generally die of Shope fibromas or Shope fibromatosis. So the correct answer is B. Lesions may be seen in the viscera and bone marrow of young rabbits. Okay, slide number 8 is tissue from an ox. Name the most likely agent. Your choices are A, Pasteurella multocida, B, Mannheimia hemolytica, C, Mycoplasma bovis, D, Mycobacterium bovis. Once again, Pasteurella multocida, Mannheimia hemolytica, Mycoplasma bovis, or Mycobacterium bovis. Okay, time's up. This question comes straight out of JKP, Volume 2, 552 to 553. And the correct answer is C, Mycoplasma bovis. What we're looking at are all small airways that have filled with neutrophilic exudate, ruptured, some have coalesced. The classic, this is very classic for Mycobacterium bovis. What you often see are the exudate-filled ectatic bronchioles. Now the surrounding lung is atelectatic because of none of the air is going to get through these airways. It is very lobular and patchy. These are all really nice for Mycoplasma bovis. The first two, Pasteurella multocida and Mannheimia hemolytica, are very classic fibrinopurulent pleural pneumonias, the classic shipping fever, although now I include 6 different diseases, including Mycoplasma bovis, Pasteurella multocida, Mannheimia hemolytica, Mycoplasma mycoides. Biebersteinia triolosi, and Histopheles somnus in the shipping fever diseases, because they can all look somewhat alike. But Mycoplasma bovis is the one which really gives you these exudate-filled airways. I like to say that they often look like little golf balls that are embedded in the lung. Your fourth choice was Mycobacterium bovis. And you almost never see lesions associated with Mycobacterium bovis. Most cattle that react, you never find out why. You might, if you're lucky, find one lymph node. Every once in a while, one is going to rupture, and you can get lesions. It's extremely rare. It has a very characteristic yellowish orange exudate, which we don't see here. So while it could be, it's not the most likely, which is what I look for. Mycoplasma bovis is a disease that continues to emerge, continues to spread across the United States, and it's very common just about all across the U.S. now. And it causes a wide range of different conditions, everything from otitis interna media, it causes arthritis, anything. Remember, mycoplasmas like to live where there are cilia. So Mycoplasma bovis, a big and still growing disease in the cattle industry. Slide number 9 is tissue from a calf. And you can say ox calf if you want. Which of the following viruses has been caused to, start over again. Which of the following viruses has been shown to cause this lesion in both calves and fetuses? Your choices are A, bovine pestivirus, B, bovine paramyxovirus, C, bovine herpes virus 1, and D, bovine herpes virus 5. Once again, which of the following viruses has been shown to cause this lesion in both calves and fetuses? Bovine pestivirus, bovine paramyxovirus, bovine herpes virus 1, or bovine herpes virus 5. Okay, time's up. This one actually comes from a journal article in the Journal of Veterinary Diagnostic Investigations in 2017 by Fulton et al. Called Bovine Viral Diarrhea Virus 1b Fetal Infection with Extensive Hemorrhage. It has been well known that bovine viral diarrhea virus 2 will cause severe ecchymotic to suffusive hemorrhages and thrombocytopenia in calves for many years. So you could pick this one up and get this just from Jubb and Kennedy. But Dr. Fulton and his group proved that it 1b, which was a little different, caused this lesion in fetuses as well. So I threw that in. The answer, A, was right out of the title. B, bovine paramyxovirus, we shouldn't see that one anymore. That's rinderpest. Has been eradicated. C is bovine herpes virus type 1. That is IBR of cattle. That will cause necrotizing lesions in calves, in the airway, all the way down into the forestomachs, down to the abomasum, and a number of other conditions, but usually not in the calves. You can see in perigenital infections, infectious pustular vulvitis in adults, but it's the same virus that causes IBR. Infectious bowel nopastitis is what we see in bulls in that particular condition. So it can cause a number of things, but it's not causing this hemorrhage. And finally, bovine herpes virus type 5 is a classic disease which is seen in cattle in South America. It causes beautiful necrotizing lesions that resemble polioencephalomalacia but have inclusions. So that was not a choice. So just remember, there is a big connection between severe hemorrhage and thrombocytopenia and bovine pestivirus or BVD virus. Okay, our last slide today is the articles also from the Journal of Veterinary Diagnostic Investigation 2019, very recently published. The question is, tissue from a group of sheep with diarrhea and weight loss. Name the most likely agent. Well, if you read the article, you're going to get the agent. Look, you can even see A and B because these pictures were lifted straight out of Journal of Veterinary Diagnostic Investigation. Tissue from a group of sheep with diarrhea and weight loss. Name the most likely agent. A. Eimeria ovionoidalis. B. Eimeria gilruthi. C. Cyclospirura subequalis. Or D. Sarcocystis gigantea. Let's go through them again. They're hard to pronounce and hard to remember. Eimeria ovionoidalis, Eimeria gilruthi, Cyclospirura subequalis, or Sarcocystis gigantea. Okay, for those of you taking the ACVP exam, this is your last practice question that I can give you before the test. I hope you get this one right. Okay. The answer is right in the title of the article. The article is by Amar et al. And it's called Eimeria gilruthi associated abomascitis in a group of ewes. Okay, this agent's also in Jubb and Kennedy. Hopefully you've come across it. And it is the only agent, the only coccidia I know of the abomasum in small ruminants. They get lots of coccidia in the intestine. Eimeria ovionoidalis is one of them. The one that everybody wants to remember if you ever get asked is Eimeria ninacoliacomovi. It's the longest one, it's the most difficult, it's one people really enjoy, but it's also one that hits both sheep and goats. Most of the other ones are species specific, and ovionoidalis is one that you will see in sheep. You can also see its megaloschizounts in draining lymph nodes, and they freak young residents out because it's the weirdest thing, and you don't think of coccidia being in lymph nodes, but sometimes they get loose, they get into the lymphatics, and they drift up there, as do the occasional ciliate from the intestinal tract. Okay, so the correct answer was B, Eimeria gilruthi. Remember, gilruthi is the one that affects the abomasum. C, Cyclospirura subequalis. That is a parasite of the abomasum. Cyclospirura, I don't know if it causes any pathology in small ruminants. There is Cyclospirura that causes gastric pathology in cats. And that's it's a nematode parasite. It's a spirurid. But it is red, so you can have these red nodules. And finally, Sarcocystis gigantea, foil D. That is huge sarcocysts. Huge sarcocysts used to be called Balbania gigantea in the esophagus of small ruminants, especially sheep. So this is my last chance to give you a couple practice questions for your upcoming examination. Once again, good luck to everyone going to Tampa this year. I look forward to bringing you more growth path challenges and getting the next crop of residents for the ACVP and the ECVP and all the other certifying examinations out there ready for the challenge. I wish everybody a great couple weeks until I see you again, and enjoy them in wonderful health. And don't stress too much. Those of you going to Tampa, you're going to do just fine. Take care now. Bye-bye.